Every parent longs and hopes for a healthy child, whether it be a newborn baby or a hormonal teenager. But the unfortunate truth is that your child will eventually get sick or potentially diagnosed with a health disorder. One of these disorders is an extremely rare heart condition called Ectopia cordis. After learning about this disorder in my anatomy and physiology class, I decided I wanted to learn more about it. I wanted to help bring awareness to this disorder so that more people can support the health community in finding treatments and cures for Ectopia cordis. Therefore, today I'm going to be talking about what exactly Ectopia cordis is, what the symptoms are, and what the potential prognosis can be, and also what treatments are available for this disorder. Let's begin by talking about what exactly Ectopia cordis is. According to the website Medicine.net, Ectopia cordis is an extremely rare heart defect in which the heart, in part or in its entirety, is formed outside of the thoracic cavity. This means that the heart can be anywhere from outside of the rib cage just under the skin to under the diaphragm in the abdominal cavity. Now, seeing as it is a developmental disorder, Ectopia cordis can be diagnosed as early as the first trimester or the 10th or 11th weeks within the second trimester. This disorder can be diagnosed with a CT or MRI, but because of the radiation from these machines, doctors try to avoid having to have their patients go through them. According to the Children's Hospital of Colorado, Ectopia cordis is usually diagnosed by ultrasound, and if it is not discovered during the pregnancy, it becomes obvious as soon as the baby is delivered. Now, obviously, the main symptoms of Ectopia cordis, according to the website WebMD, is that the heart is outside of the body. However, if it is not obvious, there are several other defects that can be signs of Ectopia cordis. Again, according to WebMD, infants born with Ectopia cordis often have other defects such as a cranial cleft, which is a split in the baby's face shape, a cleft lip or palate, which is a split in the baby's upper mouth, lungs that are not fully developed, scoliosis, which is a curvature of the spine, or an abdominal hole in the diaphragm, which is the muscle between the chest and abdomen. All these defects make life for a child born with Ectopia cordis challenging. According to the Children's Hospital of Colorado, the Ectopia cordis survival rate is just 10%. Most of these babies born with their hearts outside their bodies have severe intracardiac abnormalities, are stillborn, or die within the first few days of life. Those who happen to survive require extensive surgeries and lifelong medical care delivered by a team of specialists. However, this does not mean that living a full life is impossible. According to the website Ectopia cordis is you, Christopher Wall, the oldest person to survive Ectopia cordis, lived to be 35 years old. Now, as mentioned before, those who survive Ectopia cordis will require a lot of medical attention and care. They will need a good amount of surgeries throughout their life, both medicinal and holistic health care provided. According to the Fetal Health Foundation, Ectopia cordis treatment varies based on the child's specific needs. When a baby is diagnosed with a severe birth defect in utero, the mother can opt to terminate the pregnancy, as the Ectopia cordis survival rate is again around 10%. There are currently no fetal interventions or surgery options while the baby is in utero. However, once the baby is born, surgeries become available. On the holistic front, the main form of treatment is to protect the heart, and this is according to Ectopia cordis is you. This can be done with a gentle cloth covering or whatever comes recommended by a practicing physician. In conclusion, Ectopia cordis is a complicated disorder that we know little about. I hope this presentation has informed you about the disorder and its effect on the lives of infants, as well as inspires you to support your health community in developing treatments for Ectopia cordis. Thank you.